All right, and we are back with episode 47 of Modern Prescription. My name is Dr. Deepak Dugar.
And I'm Dr. Jeff Toll.
And we are talking about a lot of crazy stuff this week.
A lot of stuff's happening. You know, the NBA playoffs heating up, noses being broken.
I know. Nose is being done. Khloe Kardashian admitting her nose job.
I know.
We have Britney Spears having medical restraints on herself where she can't even take out her IUD.
How crazy is it that someone else gets to decide whether someone else has to wear an IUD or not?
Right.
It seems like something that would be an outrage to those who are interested in, people's fertility rights.
Right. No, absolutely. And then we have Jessie J, famous singer, can't sing anymore because of vocal nodules. What is that? How does that happen and what people do about it? We have, is tuna real from Subway?
There's a lot of weird stuff going on this week.
Lettuce water from TikTok, is that a thing?
And a new plastic surgery trend.
Yeah, elf ears. Is that here to stay? Is everyone going to get elf ears now? There's a lot. Let's get into it. Thanks for listening, guys. Episode 47, Modern Prescription. All right, so Devin Booker, Phoenix Suns, they're crushing it.
Well, I want to start off by saying I do think the Lakers would have beaten them if Anthony Davis hadn't been injured.
Stayed healthy, yeah.
That being said, the Suns are looking very good.
Right, Suns are looking
and
very good.
And Devin's nose is looking very bad.
I know. So take us through what happened to his nose.
So there's this guy named Pat Beverly
on the Clippers.
Who's known to be like the dirtiest player in the NBA. And I guess accidentally he headbutted Devin Booker and broke his nose completely to the side.
Right.
And then Devin tried to play with a mask on, like a few players have played in the past, and it felt uncomfortable, so he ended up taking it off halfway through the game.
Right.
But my favorite part about the whole thing was actually that DeAndre Ayton, who's his Devin Booker's teammate, showed up to the game wearing a T-shirt of Devin Booker's broken nose face.
That's support.
So if you break your nose like this, so what does he do? So obviously he has to finish the playoffs.
Right.
And then what is Kendall Jenner, his girlfriend, going to tell him to do?
Right. So broken noses, nose does two things. It breathes and it has a cosmetic purpose. That's it. Nose is really simple. And so as long as he's able to breathe decently and still able to function, then he's fine. And then the rest of it's now cosmetic, really. So after the first injury, it sounds like he went and got a closed reduction. Somebody pushed his nose back into place, which is usually a really minor thing.
It still looks pretty sideways.
Yeah. Closed reduction is a very minimal thing. You can't really fix it. It's not like a real repair.
But don't you think as a basketball player, the breathing part's super important? I mean, he's super a world-class athlete.
Right. So I was assuming the first thing, if you ever break your nose, you go to a doctor. They'll check for what's called a septal hematoma, make sure there's not blood collection inside the septum. That will eat up the cartilage and kill it, because the septum is like this really tightly bound tissue layer that has cartilage in between, and that tissue layer feeds the cartilage. And so if you get a blood collection, it takes away the tissue layer.
Got it.
And then your cartilage dies because it doesn't have blood supply anymore.
Sounds bad.
It's bad. So that's number one. So I'm sure they checked it. I'm sure he doesn't have a septal hematoma, so there's nothing to worry about. Then now it's cosmetic issues. And then cosmetically plus breathing issues will be something that he'll have to deal with off season.
Is this something that you think could be fixed closed, or is this one of those like that has to be an open procedure?
No, this could be done closed probably.
Good.
Yeah, it just depends on where the injury is, because open rhinoplasty is usually for like weird complex tip kind of issues and or like revision surgeries. But this kind of trauma, like we do a lot of NBA,
really?
a lot of hockey, a lot of boxers.
Have you DM'd him yet?
We will not DM. He will DM us eventually, I assume.
Bet that's true.
But his sister-in-law, Khloe Kardashian, just admitted that she got her nose done by my mentor, Dr. Raj Kanodia, which is huge because most celebrities never admit.
And it's funny because when Raj was on the show, if you haven't heard the episode, it was a great episode. You can go back and listen to that one. But what Raj was making a joke about how, when there's a famous model on a magazine shoot, they'll be like, hair by this, makeup by this, dress by whatever. And they never say nose by Dr. Raj Kanodia. But now she finally did.
She did. And it's huge. It's huge because most active influencers have been talking about it. From Mia Khalifa, Charli D'Amelio, Maddie Monroe, like all these young influencers have been talking about it.
Right.
But celebrities, classical Hollywood celebrities, never speak of it, right? And so for Khloe to come out and just admit it was a pretty big deal. And what was nice about it is that she gets made fun of all the time because of, she's the sister who doesn't always classically have the look that the rest of them have.
Yeah.
And so whenever she tries to glam up and, become something better, people try to dehumanize her
down.
They love to tear her down. And so she gets made fun of. They say that you've had 3 face transplants and like all this stuff. And she's like, listen, I've had my nose done. And she admitted it openly and she admitted Dr. Canody did it. And I think it's awesome because it's transparent and it's, not setting unrealistic expectations for young girls. Because if a young girl looks at her and says, man, how did Khloe go from that to that? And she knows, part of it was a nose job. Then they can rationalize. Like, it's not like, oh, my life is unlucky and I'm ugly and gonna, it's like, there's a reason you can get there if you wanted to. Right. And if you don't want to, you can at least rationalize that you don't have to do plastic surgery.
Right.
Yeah, so that all makes sense. Cool.
So speaking of plastic surgery, I've been seeing this trend of people elongating their upper ear, for lack of a better word, to get that elf vibe.
I know. It's in China. It's a big trend.
Yeah.
People are getting cosmetic surgery to literally triangularize the tip of their ear to look like an elf.
Yeah.
I think it's absolutely ridiculous. I do not think this will last.
You don't think that one sticks?
I do not think this one sticks. And I think anyone doing this is going to regret it in 3 to 6 months when this trend is over.
It could be. Ear tissue up there seems like easy to go back if they change their mind.
No, it's actually very hard. Ear is one of the hardest things to reconstruct.
Really?
Yeah, whenever kids are born with what's called microtia, the ear is not fully formed, we have to rebuild the ear. And so when you rebuild an ear, you have to actually create a scaffold from cartilage. We take from the rib cartilage.
Wow.
And it's so complicated to reconstruct an ear.
Okay,
incredibly complicated.
Don't do the ear thing. Then I take it back.
Don't do the ear thing. Extremely complicated. Extremely.
All right, fine.
But to take it to a little deeper let's talk about Britney Spears and what's going on with her conservatorship, which she's been in for over 13 years.
So conservatorship, the concept of conservatorship is if someone has either mental health problems, classically like very uncontrolled schizophrenia or some other very severe, mental condition, or severe dementia where they're unlikely to ever go back to how they were, then typically either a family member or someone close becomes that person's conservator legally, where they actually make the decisions for that person in all facets of life, including medical. So I've seen this in the past where, a patient, they're in their 90s, they have severe dementia, they're not able to now sign checks and do stuff. So they need a family member to actually come in and take care of their affairs. Sometimes these are just like run-of-the-mill affairs, like pay your rent and stuff like that. And if they have a more complex, sometimes it means a family member setting up their estate or other things. And you hope that this person has the best interest of the conservatee.
Right.
And sometimes a conservator becomes appointed when that person doesn't have someone else to make decisions for them. And we see that a lot in medical where, like, let's say someone's homeless and they have schizophrenia and they can't tell you about any family members. That person really can't make decisions necessarily about, where to be or do they need to be on medications, and a court-appointed, conservator can help them be on the right medications. In Britney Spears' case, she famously had that episode where she shaved her head and, there was questions about what sort of psychological thing was going on. I don't know, so I'm not going to comment on that part of it. But the point being is, I don't think a lot of us knew that there were also a conservator making decisions about all these medical things, including.
Right. We thought it was just that she was financially being controlled.
Yeah.
Now we're learning that it's medically as well.
Yeah.
Like she has an IUD in place and she's not allowed to take it out. Even if she wants to have more kids, she's not allowed to based on her conservatorship.
Right.
And that is very, very telling of how, whether or not she should be under a conservatorship or not, right? I think the fans, the whole Free Britney movement is obviously pushing that she shouldn't be under one.
Right.
And the question is not whether she should be under one or not, because none of us know the details to even understand that. But it's about, should other people be involved in it if she herself feels that her current conservators are not looking out for her best interest?
Yeah.
And that's what she has openly said.
So that's the thing is, when the court and doctors decide, this is so scary. It's like the scariest thing ever. If someone decides you need a conservator, then your opinion at that point is no longer a consideration because you don't
as a choice of who your conservator is,
or if you need one or anything, because what the doctors who decide this are saying is you're actually incompetent to make a decision.
Right.
So imagine that example of severe dementia because it's easier to think about. So let's say someone has Alzheimer's where they literally can't remember what happened 5 minutes ago.
Right.
And then
and they say
someone comes
they don't want a conservator anymore. Take away my conservator.
Yeah, exactly.
Right. You would all ignore them and say, listen, you need one.
Right. And so if that, there's a homeless person screaming at the wall and whatever, and you're like, okay, you need to take your medication. And they say, well, I don't want a conservator.
Right.
Those examples are easy to see why.
Right.
So in her case, I think you do need to re-examine whether, because she seems to have a frame of mind that could make a decision like this. I don't know. I haven't examined her. I haven't done these. But you could
based
see
on
why.
her work ethic and based on how successful she's been as an artist and a businesswoman and an entrepreneur, it would seem like she can make some of these complex decisions on her own. But we don't know the details.
Yes, or at least decide who is the right person to help
to make these decisions. Right.
Stuff like that. But that's the complex thing.
Yeah, extremely. And I think it's telling that the world has now rallied around her hard enough where she felt open enough to share her side of it. Because for the past 2 years, she's been very quiet. She never said anything about it. And now she's vocalizing it. So hopefully something good comes out of this for her.
I hope she's freed.
Yeah, I hope she's freed too. Free Britney. Free Britney. Absolutely. So what about some TikTok trends, one of which is lettuce water being the next sleep remedy. People are saying insomniacs are drinking lettuce water as a sleep aid. A beauty influencer who goes by Shapla, she documented her success with showing that drinking lettuce water at night makes her sleep better. What are your thoughts?
I'm not sure about the sleep water. I mean, the lettuce water. I do think that things that are placebos for sleep are good.
Yep.
So I like them probably better than getting someone starting to take
pills,
Ambien or something else.
Yeah.
So, in terms of over-the-counter things that I tend to recommend to people, classically, there's something called valerian root or valerian root tea that is over-the-counter. That's very safe to use. Magnesium supplements are also kind of relaxing and very safe and generally speaking, safe and good to use. Melatonin, of course, can reset the time clock. So if you've been traveling or if your sleep schedule's been like one night you're asleep at going to bed at 2 a.m. and then the next 10 and you want to restart your set point at a good time, I think that works well.
Right.
But yeah, I mean, sure, lettuce water. You may have some diarrhea. There's some fiber in there, but go for it.
Yeah, go for it. I think, like you said, placebo is really important because I think a lot of these things, it's maybe the calming effect of drinking the lettuce water, which makes you feel like it's a floral, relaxing, and but it's definitely placebo. I don't think there's anything in lettuce that makes you sleepy.
No, I don't think there's something in the lettuce.
No, I don't think so either.
But placebo works like 20% of the time.
Right. Placebo is real because sleeping is a mental thing anyways.
Yeah.
Right. So it's about relaxation.
It's about relaxation. So if you think it's going to make you relax, it'll make you relax.
Right. Absolutely. And can you sip your way to a baby with fertility tea? There are teas that are claiming that they can make you more fertile.
This one, I don't know. I don't know how that would do that. What's in the tea? Do we know?
I don't think this is possible. I mean, it's all different types of herbs and blends.
Is it also a placebo?
This is probably not a placebo. This is probably just a capitalism at its best, trying to take advantage of young females who are struggling. I don't think so. I think if you're having trouble conceiving, consult with friends and family or a physician who's really good at this stuff.
Yeah.
But I think there's a lot of things you can do to help your fertility, and I don't think tea is one of them.
I'm not sure the tea is going to help very much.
No. And then the whole thing is they're trying to say the company's sponsoring this is saying that IVF can cost thousands of dollars. Try this tea first.
Well, that is a good point.
Fertility gummies is another thing.
The tea is probably cheaper than the IVF.
Right.
It may not work as well, but it is cheaper.
It's not going to work at all. Do not drink fertility tea unless you just like the taste of it. So other concepts. One is Subway. Have you heard of Subway's tuna debacle?
Yeah,
they're saying it's not real tuna.
I actually clickbaited I got caught in the clickbait of this one. So I clicked on this. And basically the article was about whether or not Subway is using
actual tuna,
in its tuna fish sandwich.
Right.
The claim was that it was using other fish, like cheaper than tuna, for the tuna sandwich.
Right.
But actually, if you read the whole article, which I wasted, 11 minutes of my life doing.
And you're going to save everyone 11 minutes right now.
Don't read it. So what they said is they tried to do like a PCR DNA test to figure out if it was actually tuna, and they didn't get any tuna. And that tried to prove that. But actually, if you keep reading, they didn't get DNA of any, they couldn't figure out what fish it was. And they thought that was likely because the fish was cooked.
Right.
So
the DNA got killed.
The DNA was degraded. It could have been tuna. It was a pure clickbait.
So this is a pure clickbait. That's terrible. But
it's probably not really tuna.
Right.
I remember when Subway, when I used to eat Subway, like in college, and I read this article that the bread had an ingredient that was what makes surfboards, that fluffy.
Oh my God.
You know how the Subway bread used to have that fluffy texture?
Super fluffy. Yeah.
It was like they had a microscopic amount of that surfboard material was in there.
Oh my God.
And they had to take it away.
Like Yeasty Boys, the surfboards.
I don't know, man. So I haven't had Subway in a long time. I'll just say that.
So what about this one? There's an instant cure for hiccups. This doctor in Texas, at the University of Texas Health Center in San Antonio, published an article in JAMA saying he has a new device, which is an instant cure for hiccups. Basically, it's a straw. It's a special straw that when you suck through it, it completely stops your hiccups.
I don't know. So hiccups, what they actually are is your diaphragm kind of like spasming, and it makes you make that hiccup thing. And there's never been a good cure for this. My mom used to give me a teaspoon of sugar. I'm not sure what that was doing. That was our treatment. What did you guys do as a kid?
We would try to gasp and hold our breath.
That was one. Did you ever have the one where you would try to scare the crap out of someone?
I heard about that one. Yeah, we used to try that once in a while.
None of them really worked very well, and the straw thing probably doesn't work either. But I think the idea is you trying to use that muscle.
Right, to get it to actually relax, because you're trying to regain control of the muscle by using the straw.
But there is no good treatment. Like I've had post-operative patients from, you have an abdominal surgery and then you have post-op hiccups, and we try muscle relaxers, we try pain it's like unfixable problem.
Right. Yeah. I didn't realize babies get hiccups. My baby's hiccuping all the time.
I know.
And it's just normal. And it doesn't bother her. She doesn't cry. She doesn't care. Yeah. But it's just funny because we wonder if she's okay, and she obviously is. But yeah, hiccups, very annoying.
Why don't you get her the straw?
We might try the straw. It's $14, so it might be worth trying and testing. Might be worth trying.
Worth a shot.
Tour de France. They had a huge incident yesterday where a fan...
It looked like the 405 freeway.
Yeah, exactly. Exactly.
A real pileup there.
A pileup, exactly. With a fan from a cardboard sign, I think trying to get on TV.
Yeah. So she probably had seen the guy with the sign.
The guy with the sign.
The dude with the sign.
Yeah,
dude with the sign, excuse me.
Yeah.
And she tried to have her own sign. It didn't really work out as well. She caused a huge pileup.
Huge pileup. People are actually injured, broken bones. Hundreds of cyclists fell.
Well, she also ruined the
entire thing.
The entire race because all these people are injured and their bikes broke.
Absolutely. And she is potentially now going to face up to a year in prison for this misconduct.
That makes sense. I mean, don't you think if you just randomly walked in the street and tripped a bike rider that you there's some charge
penalty, some sort of penalty.
Well, isn't that assault?
Yeah, and this will be interesting how this plays out. But the problem is that it wasn't just one; it was hundreds of cyclists that got injured.
Yeah,
that's where this is like really bizarre, really dangerous. But the moral of the story, and we're seeing this in the NBA all the time, especially recently now, is that the fans have to be respectful to the sportsmen, the sportsmen and women, because they are there putting their entire lives at risk in some degree by performing for your amusement.
Yeah.
Right? They're not actual monkeys. They're not gladiators.
It's not gladiator.
Yeah. Like these are actual human beings who are choosing to do this, and you're choosing as a fan to spectate.
Yeah.
But there is a rule.
They're riding a bike up a mountain.
Up a mountain to try to win and entertain you. The least you can do is be respectful of the rules and boundaries that are put in place to safety-wise. Yeah. And with basketball, we're seeing this all the time. Fans throwing cups, fans, just ridiculous nature of fans being uncouth.
I agree.
And I think that is one thing that I think
people are too excited to be back in a crowd.
I think so. I think people are really, really back in life.
They're fully back, and they're fully, fully getting wild.
Screaming, getting wild. And talking about screaming, Jessie J, very famous singer, she recently has announced that she is having a significant amount of depression because she's not able to sing right now because she has what are called vocal cord nodules and that she's not able to sing. So she has acid reflux, which is when your stomach acids come up your esophagus and get into the back of your throat. Most people know reflux is like heartburn. Heartburn is a symptom of reflux. Doesn't mean you have reflux. Most reflux is silent, and that's where the acid gets to your vocal cords and irritates them. And then overuse of the vocal cords can also cause nodules. The vocal cords are little muscle ligaments, and if they hit each other too much, you can get nodules. And then the only way to fix it is voice rest.
So again, not to pitch our own show here, but if you want to hear more about this, we had a guest on Dr. Sean Nasseri, who's
he talked to us all about
vocal specialist, works with a lot of singers over many, many years. And he explains exactly how this happens and why this happens and how he fixes it. But this is, I take care of a lot of singers and this is a real problem. And, acid reflux affects millions and millions of people and in different ways. So some people, it can cause, like you said, heartburn. Some people it causes pain up at the top of the stomach, epigastric pain. Some people, it can even be things like bad breath, teeth erosion. Some people can get chest pain actually, where if they're worried they have, like a heart attack or something. And it can be very, very stressful. The good news is there are medications, at least for the reflux part, that work incredibly well. That, almost can eliminate it in a lot of cases. Unfortunately, once you develop these nodules on the vocal cords, especially as a singer, when you're using them with so much power, they can be frustratingly difficult to deal with.
Right. That's absolutely true. And sometimes voice rest is the only thing. I remember when Adele was touring and then she famously had to cancel the second leg of it. And it was a big deal. And it was just because she just physically couldn't sing anymore.
It happens to everyone. And it's just like a, athlete, if you're experiencing, knee pain or something, sometimes your doctor has to shut it down because it'll get, if you just keep using it, it's going to get worse with all the inflammation in there, and you just have to let it rest sometimes. I think a lot of musicians, since they mostly make a living off the touring because their record companies make a lot of the money off the records. They feel very pressured to push through, and they want to take prednisone or something to get the pain down so that they can keep going, but you got to be very careful. And advise them long term what's going to be best.
One thing I wanted to talk about too is there's a study, or not a study, this is a report that came out in Denver about a newborn that was born through C-section. And during the C-section delivery, the surgeon accidentally cut the baby's face.
Oh, I saw this.
And the baby had to get 13 stitches in her face. As a newborn because of the incident. And so I wanted to talk a little bit about surgeon and just physician in general, physician mistakes, and how physician mistakes is part of healthcare. Because a lot of people have this mentality that when a physician makes a mistake, it's you versus them. Now it's war. It's straight on war. And I think that malicious intent is what it's all about. If someone was doing something intentionally wrong versus if someone makes a mistake. And because mistakes do happen in medicine.
I mean, obviously I've never made a mistake, so I wouldn't know, but no, I'm just kidding. No, I think there are, when there's in a specific set of procedures or medical things, there are known complications.
Yes, which is, there's a degree at which you accept the risk of.
And you want your surgeon to be probably better than hopefully better or average in terms of, so let's say with knee surgeries, there's a 1% or less chance of infection with a knee surgery. So as long as your surgeon publishes their data and they're within the realm of close to that 1%, if you're the unlucky one that gets the 1%, is it a physician error? Is it just happened to be? Is it because of your wound? It's hard to say sometimes, but that's not something where I think it's the doctor's fault per se.
As long as they're within the margin that's accepted.
If the doctor is doing things inappropriately or not within the normal things that they're supposed to do and something bad happens, that's one thing. Also, if they just are not on top of things in the sense of something goes wrong a little bit and then they're kind of like too laissez-faire and things keep getting worse or whatever, that can be the doctor's fault.
Post-complication management.
Yes.
Almost being just as important as the complication itself.
Yeah, because complications happen, and then basically we have to make sure that it's, because really in medicine, what we really see all the time is that once there's a complication, that starts the snowball of you're sticking gum in the leak and then the leak somewhere else. A lot of times, because a lot of medications and a lot of procedures we do are double-edged swords. So you get, someone has a blood clot and you put them on a blood thinner and then they start bleeding. And then, that's how things tend to go. Either it goes perfectly or there's multiple complications a lot of the time.
I tell all my patients life is truly yin and yang, and nothing's for free. Like, I don't mean financially. I mean, like, any maneuver you do, there's going to be a consequence from it. Right. Sometimes good consequences, sometimes bad consequences of it. But there's always going to be a consequence. So you got to keep that in mind. And I think the average physician, is always, and healthcare worker in general, is trying to do good. I think there's very, very, very few evil physicians out there.
Yeah, you always hear those few stories, like the Nurse Ratched or whatever.
Right.
But yeah, I think there's, they're mostly trying to do good, and they usually do. And there's human error. I think there's human error in everything.
Exactly.
Just like some guy, you order a sandwich and they accidentally put the mayo instead of the mustard, and you're gonna be pissed off.
Right, exactly.
But it just has bigger consequences.
Much bigger, yeah. But it's like a bus driver. If they get into one accident, it's accepted. If they get into 6, they shouldn't be driving buses anymore.
Right, exactly.
And then let's take us through, just quickly recapping COVID vaccine efficacy now that we've been out for so long, and then also this Delta variant.
So I've had a few patients in the last couple of weeks COVID positive again. All of them unvaccinated. And I started really asking, what, we've had this vaccine out for a really long time. Like, what is leading people to be unvaccinated still? And just kind of like a quick recap of this whole situation. So the vaccines are incredibly effective. So in the month of May in the United States, 18,000 people died of COVID. And of those 18,000, 150 were vaccinated, and the other 17,850 were not vaccinated. So clearly, if you get the vaccine, you're incredibly protected from death. I think that we know that for sure.
Yeah.
What we're seeing with this new Delta variant is that some people are getting mild symptoms from it who are vaccinated and testing positive, and usually the infection's lasting for a couple days. We just saw Chris Paul in the NBA test positive and then was back playing like 3 or 4 days later. So I assume that's, I haven't heard that it was necessarily the Delta variant, but the point is that pattern of like a very low grade infection at most, or just if you're proactively testing like they are for basketball, you may pick up a positive, but pretty much asymptomatic and then back to normal. But the unvaccinated people are still getting sick like it was a year ago. And that's a scary thought. And the vaccines are so safe, I think
99% though, you said the people in the month of May, 99% were unvaccinated who passed away. 99%.
Yes.
That's insane.
And so the vaccines are, I think a couple of things I want to just be very clear, and then I'll be done. So they're incredibly safe from the fact that, yes, there are a couple, and they're open with the fact that there's been deaths from the vaccine. There's been about 5,000 people who got the vaccine and died that we can't say it was because of the vaccine, but they died of some type of thing that could be vaccine related. But as we just saw in this month alone, there's 17,000 people who died unvaccinated and almost nobody vaccinated. And over the course of the pandemic, hundreds of thousands of people have died from COVID. So obviously the risk of COVID is more than the risk of the vaccine. It's not even close. It's, multiple orders of magnitude difference. And so really at this point, really everyone really should get vaccinated and let this be done with. And the whole pandemic could be over really in America, at least if that happened. But it's going to go on and more people are going to die and it's almost all going to be unvaccinated people.
So it's all completely preventable, which is the sad part.
Yeah. Mostly. I mean, it's not completely, but basically completely.
99%?
Yes, 99% preventable. And, people die of other viruses every year. People die of the flu and people die of like less virulent things. They do. And so there will never be zero, but statistically speaking, like just get vaccinated, and this will be over.
Right, and continue to live your life.
And then you can go back to getting your ears elfified and,
and back to
drinking your lettuce water and whatever other things you want to do.
And hopefully not holding a sign at Tour de France that causes hundreds of bicyclists to get injured.
Don't hold that sign.
Yeah, let the dude with the sign be the dude with the sign.
The dude with the sign has mastered the art.
Yeah, he's so good.
He's good.
He figured out the look. He figured out the everything. He killed that.
He was good. Have you seen this guy, Sons in 4?
No.
There's a Sons in 4.
Oh, see, I know exactly what you're talking about. Yeah, the fan.
He's not, there's a Sun fan.
He's not famous yet, but he's getting famous.
He's like only for the few people that are still watching this playoffs. but yeah, he's good.
Well, Devin Booker, whenever you need your nose done, he knows where to find us.
I think if you're friends with Devin or Kendall or whatever, just let him know.
Well, thanks for listening,
guys. You
gonna
give him a discount?
We will probably not.
I think he's making like $30 million a year, so
I think he can afford it.
He can afford it.
Well, thank you for listening. Continue to share, like, and subscribe. And if you have any questions, again, comment in the DMs on our Instagram and on our YouTube channel. Please comment anytime you feel, and we will always get back to you.
Thanks for listening.